Hi, my name is Michelle.
Hi, my name is Cynthia.
Hello everyone, I'm Siling.
Hi, my name is Han Wei.
Hi, my name is Wang Ping.
We are from
Group B.
Bomb.
B.
the Sustainable Development Goal (SDG) that we have chosen for our research is Good Health and Well-being, which is the third SDG goal. In this video, we will be delivering 11 agendas as follows, from introduction to the significance of study. Our title of research is Awareness and Satisfaction Level of Malaysians towards Malaysian Government's Strategic Plans in Healthcare Sector. I will be presenting on the introduction part of this research. The reason why we choose this SDG is due to the current COVID-19 pandemic that affects everyone's daily life. We all know that healthcare sector plays an important role in handling such crises and also other diseases. In our research, we are studying 3 strategic plans implemented by the Malaysian government, which are the National Plan of Action for Nutrition of Malaysia 3, Immunization Program, and the National Dengue Strategic Plans. Under each plan, we also studied on 3 sub-programs. Firstly, under the National Plan of Action for Nutrition of Malaysia 3, we have the nutrition counseling services which provide assistance to individuals or groups of people on balanced diet, dietary management, and healthy lifestyle. Then we have the supplementary feeding program which improves the intake of nutrition for mothers. We also have the Healthy Cafeteria which provides safe and nutritious food to the consumers. This plan has benefited up to 150,000 Malaysians to date. In addition, the second plan is the immunization program which aims to protect the Malaysians from the diseases by ensuring that each of them is able to receive the immunization service. Under this plan as well, we have 3 sub-programs under research which are the Measles Elimination Program, HPV Immunization Program, and the Hepatitis Control Program. Each injection of vaccine has been scheduled in a systematic time frame manner as listed in the slides. For the last plan, which is the National Dengue Strategic Plans, we have National Cleanliness Policy and Integrated Vector Management with focus on the cleanliness of environment, limitation on the usage of plastic bags, spraying of tetanus EC or BTI at the hotspot areas, cleanliness activities and implementation of waste collection system. Then we have Clinical Practice Guideline, where the main feature is the early detection of dengue cases, standard and effective dengue management, public awareness on symptoms and signs of dengue so that they can seek for medical treatment as early as possible, and lastly, the medical practitioner awareness to detect dengue cases. We have also social mobilization and communication for dengue, which aids in spreading the awareness of dengue prevention. In the past literatures, they only focus on the study of awareness level but not the satisfaction level. In our study, we investigated and analyzed not only the awareness but the satisfaction level of concerned Malaysians towards the plans or programs as well. In addition, according to some articles that we have read, most of them only limit their area of interest in a particular state. Our study does not limit to a small particular area. Instead, we widen it to the whole Malaysia. The overall aim of this inquiry is to investigate and analyze to what extent, to what level is the awareness and satisfaction level of Malaysians towards Malaysian government's strategic plans. We hope that with our study, we are able to know their opinions regarding the plans for any room of improvements in the following years.
Proceeding to literature review, the first article is known as Knowledge, Understanding, Attitude, Perception, and Views on HPV Infection and Vaccination Among Healthcare Students and Professionals in Malaysia. The article is to study the perspective and knowledge on human papilloma virus, or known as HPV, infection and vaccination amongst healthcare students and professionals in Malaysia. In this study, a survey was conducted on Malaysians with the age group of 17 to 45, since cervical cancer is most common among the age group of 15 to 44. One of the interesting findings is that most of the young respondents mentioned that their parents would disagree to receiving HPV vaccination. One of the gaps in the literature is that it only focuses on the study of awareness towards HPV infections and vaccination, but not satisfaction level. Therefore, reviewing this literature provides us the idea of including satisfaction level of Malaysians towards the plans or programs implemented by the government in the healthcare sector. Next, the second article is known as Cafeteria Sihat Initiative in Malaysian Public Hospitals. Do customers accept it? The aim of the study is to judge customers' level of acceptance towards Cafeteria Sihat by evaluation methods such as questionnaire with the choices of answering 4 additional subjective questions. According to Ministry of Health, MOH, the Healthy Cafeteria program is created due to the alarming prevalence of non-communicable diseases, NCD, in Malaysia. Therefore, the aim of this program is to promote healthy eating habits amongst Malaysians. More cafeteria sehat leads to the achievement of second and fourth indicators of NPA and M3, in which the goal is to support a healthy eating and active living, besides preventing and controlling obesity and other diet-related diseases. One of the gaps in this article is that the responses from the customers were only representing the state Selangor and the federal territory Putrajaya. Moving on to the third article, it focuses on the dengue incidence and the prevention and control program in Malaysia, which includes the National Dengue Strategic Plan. In this article, it is proven that urbanization of the country has led to increased dengue cases. Climate changes such as rise in temperature, increase in rainfall, relative humidity are the main factors of dengue transmission. Poor cleanliness in the environment also plays a part in contributing to the rising Aedes breeding index. To cope with the surge of dengue cases in the country, the government has taken the initiative to implement dengue control program in National Dengue Strategic Plan (NDSP) since 2011. The continual efforts managed to lessen 60% of the total number of dengue cases within 3 months. MOH also collaborated with the Construction Industry Board and Department of Safety and Employment to carry out enforcement activities on a regular basis. Proceeding to Article 4, Knowledge, Attitude and Practice regarding dengue among students in a public university in Malaysia. The aim of the study is to investigate the knowledge, attitude and practice of the students in International Islamic University Malaysia, IIUM, in Kuantan, Pahang. Data were collected from 6 different faculties in IIUM. According to the findings, all respondents from the survey were aware of what dengue is. Reviewing this literature enables us to prove that there is a correlation between the implementation of National Dengue Strategic Plan in 2011 and the people's awareness towards the plan in 2020. The first gap in this article is that it does not investigate the satisfaction level of the people towards the strategic plan. The second one is that it only focuses on the students of IIUM, which is unable to represent the whole population in Malaysia.
The problem statement in this research is the people awareness and satisfaction level towards Malaysian healthcare strategy plans. This research is able to reflect the people's awareness about the strategies that are implemented by the government. So, the actual issue in this topic is the uncertainty on whether different initiatives taken by the governments is sufficient or effective enough to satisfy the Malaysian needs in the healthcare sector. Thus, this led to our inquiry, which is what are the strategy plans that has been done by the government in order to improve the health of its people. The opinion that gathered from the public is important to the Ministry of Health because the Ministry of Health should take the people's feedbacks into the consideration in planning their strategies to provide better healthcare services. Therefore, our inquiry questions in this research are: to what extent Malaysians are aware of the Malaysian government healthcare strategy plans, and how satisfied are Malaysians with the Malaysian government healthcare strategy plans? Our objective of the study is to understand to what extent the Malaysians are aware of the Malaysian government healthcare strategy plans, and also to analyze the satisfaction level of Malaysians with the Malaysian government healthcare strategy plans. Since we are using the qualitative methods of data analysis, therefore the proposition of the study is the majority of Malaysians are aware and satisfied with the Malaysian government healthcare strategy plans.
In research method, we will be talking about the inquiry context, data collection, sample size, and sampling design and demographics details. In inquiry context, we discuss about the problem axis behind our research, which is the uncertainty of current awareness and satisfaction level of Malaysians towards the government's healthcare strategic plans. Therefore, the purpose of our inquiry is to study Malaysians' awareness and satisfaction level, besides soliciting responses and their thoughts on the 3 strategic plans mentioned. Evaluating Malaysians' satisfaction level towards the plans acts as a platform for the government to seek for feedback in constructing their plan of action. Next, qual-quant data collection method was used in our study. Literatures published were reviewed to gain more insights on our topic. We also collected information online by accessing the Google Scholar, Open Athens, and official website of Ministry of Health. Other than that, Google Forms survey was spread through social medias to collect primary data from 50 respondents who are Malaysians. In the survey form, respondents were required to answer about their awareness towards the strategic plan selected, besides rating their satisfaction using the 5-point Likert scale and provide suggestions to improve the plans. The survey did not require respondents to reveal their identities, and their responses will remain confidential. Our population of this study is Malaysians at all ages, while the sampling unit for this sampling frame is the various age and education level of the respondents. The probability sampling is used, where every unit of population has an equal opportunity of being selected to yield an accurate result. The sample size for our research is 50 to meet the requirement of central limit theorem, which states that the distribution of the sample means will be normally distributed if the sample size is greater or equal to 30. As a result, the average of the sample mean can be approximated as average of population mean. With that, a group prediction and analysis can be made in this research. As for demographics of respondents, data collected for gender, education level, and age group are as shown in the figures.
From the result, we get that 90% of the respondents are aware of the immunization program, 64% of the respondents are aware of the National Dengue Strategy Plans, and 56% of respondents are aware of the National Plan of Action for Nutrition of Malaysia 3, 2016 to 2025. Well, in terms of satisfaction level, the immunization program is 4.3, followed by the National Plan of Action for Nutrition, which is 4.1, and finally is National Dengue Strategy Plan, which is 3.8. In overall, the Malaysians who are aware with the healthcare strategy plan are satisfied with it because the satisfaction level for each plan is 3.8 and above.
For the project implications, through our study, this project brings good impacts to the readers of society. For example, when a person fills out the survey form spread by us, those who are initially unaware of these healthcare plans will get to know about it. Then those who may need it will be able to take this advantage and utilize it well. So on the other hand, the feedback received from the survey are able to help the authority in the process of drafting the better healthcare strategy plans. In short, with this research, Malaysians are able to be more aware with the healthcare plans and benefit with these healthcare plans implemented by the government. Besides, the authority are able to take the people's opinion into the consideration in healthcare strategy plans. As a result, this will promote the good health and well-being of Malaysians. For the managerial implication, after conducting our study, the result that we got from the survey and questionnaire provide the opportunity for the organizations to plan and implement relevant strategies. First, through the survey conducted in our study, the voice of the people can be heard and the shortcomings of the plans implement can be identified. With this, the Ministry of Health can make amendment and overcome the shortcoming of the plans. The mass media also play a significant role in this case, as they can help in advertising the details of the strategy plans so that more Malaysians are exposed to the information. For the academic implications, our study may gain attention and interest from the other researchers. The researchers who are interested to progress deeper in the scope of study, they can investigate whether these efforts suggested are practical or effective. In our survey, we only study the awareness and satisfaction level of the Malaysians towards those plans, but we did not further investigate the factors that affect the low awareness and satisfaction level. And our study also did not study the relationship between the usability and satisfaction level. Thus, this can be the best line for them to further study about it. With this, the rest of the academicians of the researchers will gain a deeper understanding towards this area of work. All these studies, reports, and surveys can be taken as a model for the following research. So for the significance of study, the result of this study enables the government to make improvement on the healthcare plans in many effective ways. The government should pay more attention to the opinion from the people for any room of improvement to ensure a better version of healthcare plans in the years to come. As a result, Malaysians will be able to enjoy the better quality service under those strategy plans. In short, this study is essential to discover the relationship between the strategy plans implemented by the government and the awareness and satisfaction level of the Malaysians towards them.
That's all from us. Thank you.
Bye.